and we begin right away to ask questions about what could be the science that is informing a contemplation of easing the restrictions in Ifeda. Already it does appear that there was some disquiet about, removing the lockdown at a time when it was removed. And as you know, that our numbers have climbed so very fast. And in the last 2 weeks, it has risen so rapidly in the leaps, so that we are nearing 6,000. We have done 5,638 confirmed cases. Joining us on Zoom is Kwame Sarpong Asiedu, pharmacist and fellow, Ghana Center for Democratic Development, CDD. Kwame, thank you so very much once again for making time to join us from your UK home.
Samson, for having me, and thank you. Good morning to all your listeners as well. Great.
So our audiences have been very excited about how straightforward you have been in educating them and dealing with the matters in the manner you have done. The first question we would like to ask will be on the basis of these clips that we are going to watch now. There was a press conference held, and we have heard suggestions that the restrictions might be eased now. In fact, not only suggestions, but there have been actual steps that have been taken as far as the tourism authority is concerned and that affiliated ministry is concerned. Something happened and got people really mad, and within some minutes things got changed. We also have some of the clergy who have been clamoring for an opportunity to go back in the church rooms, church houses. Let's listen to Dr. Bedu Sarkodie, doctor who is Director of Public Health of the Ghana Health Services. We'll hear Kweku Ajimanmenu, who is the Minister of Health, and Kojo Opon Nkrumah, who is the Information Minister, on easing of the restrictions. We'll come back to you right away.
The new cases confirmed that added to what we reported 122, with the distributions in Greater Accra 57, Ashanti Region 62, Central Region 2, and Western North 1. 2 more new deaths were added up, bringing the death toll to 24, with 24 deaths among 5,530 cases. The death to positivity rate, which we term as the case fatality rate, stands at 0.43%.
Coronavirus has come to live with us. It will have nowhere to go, and we'll have to live with it. There are several diseases that we live with. Malaria has been with us for how long now? HIV/AIDS came. We have never been able to take it off. We still live with it. H1N1 is still around. We live with it. There are several other diseases that we live with. Non-communicable diseases, they don't get spreading and they are not infectious. But when you get it, you live with it. And the word that we all use is managing to live with the disease. The impact is severe, very, very severe elsewhere, because people are dying in numbers. Here in our country, we are now seeing community spread, but we are not dying.
Government envisages that in the coming weeks, it will need to outline a gradual plan for a post-restrictions era. Pursuant to this, the President of the Republic, Nana Addo Dankwa Akufo-Addo, has commenced engagements with various stakeholders on safety measures that can allow an easing of the restrictions without compromising the health of the population.
Right. So, Kwame, presently where we are with the confirmed numbers of infections, is this something we should be thinking about immediately?
I did say on the Super Morning Show that I look at our disease projection for a number of ways. How our case count is building and our recoveries. and I did say that at its heart, public health and epidemiology is just arithmetic. What you need to look at is the strain that is going on to your health system based on your active cases. It is gratifying to note that today there has been a considerable number of new recoveries that have been reported, which is in line with our disease trajectory because we've had relatively mild and moderate cases. And because the time lags, it takes about 14 days generally for people to recover. If our case count doesn't build up considerably moving forward and our recoveries improve and stay on the same trajectory, then our active case count is going to go down. If that happens, then yes, our health system would be able to cope because it's coped this far with the numbers we have. So there's no reason why it cannot cope with less. Having said that, that would also rely on our human behaviors. If you look at currently the latest, Ghana Health Service information that was released, you would realize that our daily test numbers are going down slightly if you look at the data. And also going down is our positive test in numbers. My only concern there would be that as we are not testing as much as we did when we ramped up, would there be considerable community spread because our positivity ratio is still around 3.27? It's not gone down, which means for every 100 people, about 3 are testing positive. Considering that we are pushing this down, are people going to stay in the community longer not knowing that they have this disease and as a result report late, which would then have an impact on an active case count and take us on a different trajectory? So those are the two things I'm looking at. But to answer your question, the world is trying to open up. Worldwide, they are trying to open up. So it is not out of place to see that the government is making noises around that conversation that it wants to do same as well. How it does it and minimizes the impact on us from a disease case point will be the interesting bit.
What do you make of what happened between the tourism, the regulator of the tourism industry and the ministry?
Well, I think that was a bit of an embarrassment, to put it mildly. It was because I would have expected that the regulator would have liaised with the ministry to make them understand whatever communication they were going to put out. Unfortunately, that didn't happen. So we had a situation whereby some even said that the regulators, information that had been put up was fake, and therefore it became a huge problem there because it was more like, what is going on here? Were we being taken seriously? Were we being treated as children? And this was a bit of a concern for me. So at least I am happy that the ministry has put things in place to actually streamline the whole problem.
So if you look at what the directive that came from the regulator, as in the Ghana Tourism Authority, it just opened up. It said all hotels can operate as normal and host their guests subject to the specified elevated hygiene protocols and social distancing. 2, food chains and restaurants can operate, sit down, as well as pick up and delivery services while observing appropriate social distancing and hygiene protocols. Drinking bars, that's the 4th one. Drinking bars can operate while observing appropriate social distancing. What would have been the consequence if this was allowed?
Well, the first thing you have to look at something is the fact that it's not possible to wear a face mask and eat or drink. So that would have been a fundamental breach of the directive from the president, which said that we should wear face masks when we're in public. So that in itself was a challenge, if you put it mildly. The second thing was that when people have consumed alcohol, that social interactions change considerably. And therefore, even in rational times, we are struggling to see the general public obey these social distancing protocols or obey them in buses, let alone when they've let their head down. That was another challenge. And the fact that we were going to then allow people to more or less take responsibility at a time when we have realized that educationally people do not even have a good understanding of why they should be doing the things we need to do to keep this disease at bay was something that worried me.
Right. But whilst the ministry issued a further directive and said, 1, food chains and restaurants, including hotel restaurants, can operate takeout and delivery services only. So you don't go in there and sit and eat and drink. Drinking bars remain closed. So this was very emphatic, instead of the earlier one that drinking bars could operate. The other issue that comes up is that in the main legislation, if you like, the EI 4064, which provided for these measures and prohibited conferences, gatherings, festivals, workshops, among others, it provided an exemption for the list that the tourism authority had actually said could go ahead and do what they have to do. So by law, as we speak, what the tourism authority said was in compliance with the law. It did not flout any law. So that today, as we speak, if anybody, any hotel, any restaurant, drinking bar operator went ahead and operate in the manner that the tourism authority directive said, you could not arrest them. You couldn't do anything to them, because they have enjoyed an exemption in the original law itself.
Well, yes, but at the press conference, if you listen to the tourism minister,
right,
she did point that out. And I think that in times like this, common sense must prevail as well. The fact that you see a loophole in the law, and you realize that that loophole could probably put people in harm's way, doesn't mean that you should profiteer and exploit the loophole to your advantage. Because what you'll be doing is trying to get business. But if you are not careful and the people came into your premises and got you infected, you probably might not even live to enjoy the profits.
That's right.
So common sense has to prevail here. It shouldn't just be that, oh, there is a hole, I can jump through it, I can jump through the hoops and I'll get there. I don't want us, we need to, as far as possible, be rational and support some of the things, even if the legislation has left gaps. At the end of the day, it's our life. It's not just about government. It's our life as well.
That's right. So it's public health. And as we know, not everybody will be as compliant and act in good faith like you are saying. Not everybody would want to comply with all the rules. And some of these operators have been very excited about the opportunity to do their business. I require the government to protect me. If you have seen an error, you fix the error. You don't just come tell me about the error, because there are bad ones who could take advantage of the error and you couldn't do anything to them, but members of the public will be hurt.
You're right there, and therefore I would expect that government would correct the anomaly. That is important, that loophole is blocked. But in the meantime, you lawyers would say, he who goes to equity must come with clean hands. If you genuinely know that there's a pathogen on the loose, and you say that because there is a hole and you cannot be arrested, you would exploit it, that is bloody-mindedness. You are just being foolhardy.
Right. And
it is like you said, it is about your health, it is about my health. At the end of the day, you can get infected. Forget about even the general public coming into your premises. What if you got infected? What if you lost your life? What if you lost your livelihood and you are the main breadwinner of your family? Sometimes we should think beyond the law and all the caveats that it gives us and act in candor and show that we are human as well.
What do you say to the churches who are also clamoring for an opportunity to begin their operations? They have given assurance that they will protect the members. They will ensure that they stick by the measures. They are informing us that that was not their own initiative. It was a request from the presidency for them to submit what they think they could do if it is opened up, and they did that. So why are we all sort of criticizing them, and some people basically insulting them for suggesting that the churches could be opened?
Again, I think it comes from the pronouncements of the church and church leaders themselves. If you listen to the press conference and listen to Kojo Ponkruma, he alluded to that fact. He did say that the president had asked for suggestions and inputs because obviously the conversation about opening up is ongoing. But the thing is, if you make a suggestion, it doesn't mean it has been taken. You lawyers would say advise. If you advise your client is not compelled to take your advice. But that advice comes with considerable professional input, and that is what has to happen. So I would have thought that the church leaders would have given their professional input. It's about the president considering it in the light of what we're dealing with and the protection of the general public that he has sworn an oath to do, and come up with a decision that best protects the public, because the prime responsibility of the government is to protect the public,
right,
not to please the church leaders.
Right. So as we speak now, these various interest groups are making these suggestions. And like the minister says, we have to live with the disease. Of course, I have just seen a World Health Organization document which is also admitting the fact that this is going to be with us for a while. We should focus on vaccines and, trying to canvass nations around to bring support so that we can have vaccines that are free and available to everybody. I think our president is the first who signed it. Why should we not be talking about easing up?
Yeah, and like I've said, you're right, we should be talking about easing up. It's a conversation we need to have. If you remember 2-3 weeks ago when I was on this same program, I did say that this virus is going to stick along for a long time. And that was a reality that a lot of people were not prepared to live with. The issue is that if you look at it from a world opening up standpoint, no country that has gone down its epidemiological curve would want a second spike. Okay. Which means if you are coming from a country where you've have a history of infections, they will have to find a way of making sure you're not infected. And that's why there will be quarantine protocols in place. That if you come to Ghana, for example, 14 days, now the UK is saying the same thing. If that happens worldwide, it will have considerable impact on business and the international economy and GDP of especially smaller countries. Because if I had to go for a meeting in Ghana, if I had to come to Ghana for a 4-day meeting, say at CDD, and I was going to be quarantined for 14 days, it means I have to factor in 18 days to come to Ghana. When I have other things doing, likewise, if someone had to come and meet me in England, they've got to factor in, if it's a 4-day meeting, 18 days. If I'm coming for a 2-week holiday in Ghana to do my private business, I've got to look at a month. These are not practical. And therefore, you need to find something that would ensure that another school of thought that's coming up is what we call the rapid detection tests, the RDTs, where you test at ports of entry before, and even airports before people get on planes, whether they've got antibodies to COVID. That is another school of thought. Or you test at your airport, and if the person doesn't have antibodies, then you quarantine them for 2. Alternatively, then you have to induce immunity using vaccines. The question about the vaccines is that the countries in the, middle belt of development, the lower middle income and middle income countries, are considerably disadvantaged when it comes to vaccine research. And hence that document that you've seen that His Excellency Dankwa Akufo-Addo has signed. The bigger question is about the fact of how that can be implemented. Because the point is, these countries where the research is taking place have committed their nation states and their citizens and exposed them to this pathogen so they can get the antibodies and start developing a vaccine. That has come with collateral damage in high mortalities. If you look at somewhere like the UK, they've had high mortalities. In the US, they've had high mortalities. But what is the collateral positive? It is the fact that a country like the UK is leading with 2 of the vaccine candidates. And even yesterday, the preliminary research from macaque monkeys to show that immunogenicity generates immunity in these monkeys after 4 weeks using the Oxford vaccine, which is a very positive thing, which most likely means that those who have been injected in human subject in the phase 2 trials, if the same thing is produced, then we are on our way to a vaccine. What is the contribution of us in Ghana, Africa, going to be? Are we going to be part of the phase 3 trial of this vaccine so we can go into bilateral agreements and say, because we contributed to the development of this vaccine, it is only right that our citizens can benefit fairly from it? If we don't do that, then I doubt it will be acceptable just to go to them cap in hand and say, after investing your human resource, your financial resource, your scientific resource, investing your pharmaceutical industry and getting this as a huge cost, come and give it up to us for free.
That's interesting.
Even that is against natural justice.
Yeah, that's interesting. So even as I look at that WHO document, you can tell that countries who are committed in finding a vaccine are not subscribing to it yet. And bigger corporations who are investing money into vaccine, nobody is subscribing to it yet. We can only pray that maybe sometime soon they will agree. Final question to you. The Minister for Health complained about the lack of compliance, the level of compliance with the protocols. He's been talking a lot about it, and anytime he has the opportunity, he literally is pleading on his knees with everybody to abide by these measures. For example, wearing of the mask. He was literally at the point where he said maybe very soon we'll have to translate the directive into a criminal sanction. So if you don't wear it where you are supposed to wear it, then you get punished. In the circumstance of the level of compliance that has led to complaints and concerns, if we are easing up, what are the extra measures that we'll be looking at whilst we ease up?
The first thing is what I've talked about, because if you want to ease up, you don't want your disease trajectory to change, which then means that if we have any containment strategy that prevents the disease from coming into our country, we have to continue with it, which might mean that our borders would have to be well regulated.
Okay.
So that it doesn't come in, which would imply all these quarantine arrangements and other things. The second thing would be personal responsibility of the citizenry, where we wear our face masks, we practice social distancing, we wash our hands, we practice personal hygiene, we are aware. But more importantly, there has to be education, public health education, because anyone who goes into public office elects to go into public office. You put yourself forward, even if you are headhunted by the appointing authority, you still elect to take the position. And therefore, you know the sort of human beings you're dealing with.
Right.
So if you're communicating to them, and the communicating is such a way that they are not getting the education that they require, you need to sit back and ask yourself, am I educating them properly? What is it? It's one thing saying, oh, I'm educating them. It's like going to school and putting your kids in school, and the teachers say, we teach them very well. And every time the reports come, they go and sit every exam and they fail. And the teachers are telling you they're educating them very well. No, surely there's something wrong with the education. So we need to look at the education properly. Then finally, the government has a responsibility to protect us all. In that protection comes legislation and enforcement. If people are going to behave like what we saw in the Ga area where Garmanch is installed with drumming and dancing, no social distancing, no wearing of gas masks, the same thing happened in Ekopo-Ekwapim, and we cannot sanction anybody, or they are sanctioned marginally. But then I go and I don't wear it, or I organize a mass gathering and I'm jailed for 4 months. Then, like Malcolm Gladwell always says, the law must be seen to be fair, and it must be seen to be equitable, and it must be seen to be predictable.
All right.
If we don't have equity, fairness, and predictability, then people would rebel. And if they do so, we'll get nowhere.
Thank you. Thank you so very much. Kwame Sarpong Asiedu is a pharmacist and fellow, Ghana Center for Democratic Development, CDD.